I am Jenny Nyholm, the Mental Health Outreach Coordinator for Tri-County GLAD. Welcome to the June 2017 Community Education Blog, entitled The Opioid Epidemic, a Global Problem. The opioid epidemic refers to the rapid increase in the use of prescription, non-prescription opioids in the United States and international countries. Ultimately, opioid addiction is a serious global problem affecting health, social, and economical components of society. World Psychiatry, January 2017, documented that opiate addiction is also now a serious problem outside the U.S., mostly among young adults. It also adds that most deaths worldwide from overdose were from either medically prescribed opioids or illegal heroin. The opioids may include heroin, morphine, and non-prescription and prescription pain reliever medications. What do I think about the medication prevention from doctors regarding surgeries and the procedures? People taking medication, I think it remains temporary. It should be temporary with limited time. If someone wants more, the doctor should restrict the prescription. If he or she cannot, then take an Advil. Yet, something should be restricted because people can be addicted and get immense and heavy drug use. He or she can become addicted. Time is restricted. Today, it's amazing to see such an epidemic where many young people use opioid prescriptions. A group of drugs, wow, a real impact. Why? It is used to reduce the pain or different ways. The more the person continues, they become addicted because the body is so dependent. Wow, that leads to the body craving and wanting. The body already produces the dependence of the medication, and it leads to excessive use of the medication. Yes, that means someone, can we prevent the reduce of the numbers of those who use it? How? It's important to spread the word, the awareness to the others, and try to use the medication only if needed to stop and let the body function. Hello, I'm Joel. Well, the opioid epidemic. It's a national and global problem. My opinion, I support it for medical reasons. Misusing and becoming addicted, I do not support that. Okay, I've been wondering about opiates and as a drug, some people go to doctors because they need the medication for their pain, such as Oxycontin. It's a pain medication. To me, it is sometimes people take the medication all the time to get excited. All the time. I see this. What if someone takes this and gives it to another person? So then the other person takes the medication. I see it, and I'm not sure if this is good for that person. It may kill. Let's say that person who is between 13 and 29 years old, and the other kind of drug is, heroin. Something with a syringe for pain or something like that to feel good. No. In my opinion, I don't think it's safe. It's not good for your brain. It will damage the brain and the body. Physically, it can kill. That's my opinion. Hello. What do I think about the pain prescribed by the doctors after the surgery? Well, I have an experience with a friend who had surgery and was strong on pain medication. He took the medications to become immense. He got high and then he became addicted. So he decided to stop himself. And as he did not expect himself to become addicted. I feel that the doctors should know better and to limit the time for recovery than listening to the patient and giving the medication, taking advantage of the money. The policy should be changed regardless of medications. Doctors prescribe opiates for their patients. However, people buy opiates through drug dealers. Death rates from the synthetic opiates, including fentanyl, rose a whopping 72.2% from 2014 to 2015 across the country, according to the data from the Centers for Disease Control and Prevention. Jacqueline Howard from CNN revealed that a total of 33,091 Americans died from opioids. Opiate overdoses in 2015, and 91 Americans die every day from an opiate overdose. U.S. News and World Report, April 13, 2017, reveals that prescription drugs monitoring programs, PDMP, exist in every state since the program started in April of 2017. It also discloses that PDMP allows pharmacists and prescribers to access the patient's prescription histories to identify suspicious use. The U.S. Department of Health and Human Services, HHS.com, illustrates that opiate abuse is a serious public health issue, but preventative actions and treatment for addiction and proper response to overdoses can help. Thank you for sharing your views on the opioid epidemic.